going to just tell you very briefly a little bit about ourselves and our clinic, and then what we really want to do is answer your questions, because we want to just get to your specific questions and your specific needs. So our clinic has been around for 26 years. So the clinic was founded 26 years ago. And we've been helping prospective dads now for about 20 years become parents. You can take a look at every clinic that you look at. One of the things that you always should look at is obviously the pregnancy rates of the clinic. And there's lots of resources that you have. You can go to the clinic's website for pregnancy rates. You can also go to the SART database, and you can look at pregnancy rates over there as well. One of the philosophies in our clinic is continuous communication with our patients. So whenever you need us, we're always available, by email, by Skype. For example, I'm in Israel right now. I have a patient, a couple in France, and they found an egg donor, but the egg donor decided that she didn't want to donate her eggs. So they were very upset, and so they wanted to Skype with me last night. So last night we had about a half an hour Skype. So we're always available. It doesn't matter where we are in the world. We're always available for our patients to answer their questions and really address their needs. So that's our major philosophy in our practice. We do a lot of research. You'll see some of our publications if you go to the NIH website, which is the American website for NIH research. You'll see all the publications that we published in the last 20 years. So we're very active. We talk internationally and nationally in the United States about IVF and about surrogacy. We're going to be in London in March talking about whether to transfer one single embryo or two embryos, and how do you make that decision, and what are the risks.
And we talk to you about that. So we go through, when we're going through the process, you know, when we know how many embryos we have, we know what you want, and we discuss, you know, what the right thing to do is for you as an individual. So we have individualized care. So no two people are exactly the same, no situation is exactly the same, and we tailor it to you specifically. But we are the people that are watching out for you in terms of getting the right gestational carrier, the right surrogate, getting the right donor, and then making sure the process runs very smoothly and efficiently. Because we only want to do it once if we can. That's our goal, get this done once. But if it has to be done more than once, we have some programs that you can be part of so that you know that won't be a tremendous economic burden for you. So our financial office can talk to you about that, how we have different ways to help you do that. And we will break the whole situation down into a total of 5 steps, and Dr. Donovan's going to explain those 5 steps to you.
One of the things you can also, you know, the most expensive part of this journey is if it doesn't work. So if you go on the Men Having Babies website, you'll see some of the clinic reviews. You'll take a look at our center, and you'll see how many times it's taken us to get our prospective dads to parenthood. In almost probably 99% of cases, just once. So the journey, and again, I'm going to talk very quickly because I want to get to your questions. I think your questions are more important than me just coming and talk to you about things. But there are 5 steps to this journey. The first step is we do a Skype consultation for an hour. We go over everything, all those steps and the questions that you have and the concerns you have. The second step is if you're already working with an agency, then we work with that agency to find your surrogate. We have our own donor database, so the first day we meet with you on Skype, we give you the password and the website, so you can take a look at our donors, and if you want to choose our donors. If you don't, you want to choose an agency donor, you can choose agency donor. The difference is that when you choose the clinic's donor website, you don't have to pay agency fees, so it becomes less expensive. But some patients want a particular type of donor. For example, one of the agencies that we work with, has mainly Jewish donors, which is great, so we use them if patients are looking for a particular type of donor. So the next step is find your surrogate. And again, finding the surrogate takes the longest time. It can take 1 month, it can take 8 months to find your surrogate. But your surrogate is the most important part of this journey because you have to make sure the surrogate is healthy. You have to make sure she's able to, for example, if you want twins, to carry twins. You don't want your babies to be born at 32 weeks of pregnancy and have to stay in the hospital for 2 months. Because if she stays in the hospital, the baby stays in the hospital 2 months, that can have medical problems. They can have medical problems for the rest of their lives. So I always tell our couples, the most important thing is to find the healthiest surrogate so that we can minimize any complications during pregnancy. We want you to have healthy babies. We want, our parents come back to our office with their babies, and that's like the best day of our lives, because we know that we've been able to help them, and we know that we can see the babies and they're healthy and the parents are happy. So the surrogate, finding the surrogate is the most important thing. That's the second step. Then what we do on the third step is we do all the testing. So in the egg donor and the surrogate, they fly to our office one day, and what we do is they spend the whole day there. We do all their testing. So all their genetic screening, their infectious disease screening, we do psychological screening on them. So all of that is completed within one day. Once that is all complete and all the tests come back on your donor and on your surrogate as normal, then we go to the fourth step. And the fourth step is legal contracts. It's where people get headaches because you have to read a 30-page contract between you and your surrogate. But that's important because there are things in that contract that are very important. For example, let's say 1 out of 1,000 times there's a baby has a problem, and it's a significant problem, and you want to make sure that that surrogate understands that you're the one that's going to make the decision on that pregnancy. You're the one who's going to determine whether that pregnancy is going to continue or not. That's all in the contract. In the United States, we live by contracts. We live by the legal court system. So you have to make sure those are done. So sometimes it takes 2 to 3 weeks to complete the legal contracts. Once the legal contracts are completed, then we do the fun stuff. And the fun thing is to stimulate the ovaries of the donor to get as many eggs as possible, and at the same time prepare the uterus of the surrogate. And then the decision comes, do we transfer 1 embryo or do we transfer 2 embryos? And before we even make that decision, we don't want to make that decision on the day we're going to do the transfer. We want to make that decision beforehand. And we talk about the risks of transferring 1 embryo. Many couples are worried because they say, well, if I transfer 1 embryo, I'm going to have half the pregnancy rate. Well, we have the 7th highest pregnancy rate in the country in the United States out of 600 clinics, and 40% of the cases that we do are single embryo transfer. So if you know how to do something very well, you can do single embryo transfer if you want. That's something you want. If you do, say, twins or sometimes can have higher complications, we can do single embryo transfer and still have very, very high pregnancy rates.
The most we ever put in is 2. That's the maximum in our clinic that we'll put in anyone at any time. But we encourage the use of 1 at a time because it's always a healthier pregnancy. We hope when there's 2 that we can get as healthy as a single pregnancy, but you never get more healthy than a single pregnancy. So that's always the best because women were really designed to carry 1 baby. Now 2 can still be okay, but every time you go above 1, you have an increased chance of having other types of problems. And the biggest of which is preterm delivery. Because the human uterus is only meant to carry, at the maximum, around 12 pounds of baby. So some 10 pounds. Well, that's okay for 1, but if you have 2, by the time they get to 4, 5, 6 pounds, they can start to make the uterus become unstable and can be born prematurely. When they're born prematurely, then they can have all sorts of other problems. So the goal is to try to get a pregnancy all the way to term. And we know we know about all the pressure to want to get 2 at once because you get it done at once, and you don't have to come back for another gestational carrier or the same gestational carrier again. We know those concerns, but sometimes you have to balance them out. Sometimes it makes more sense to do 1 at a time. From our perspective, from our costs, it's virtually identical to do it as 1 now and 1 later because the charge that we have, at least our part of it, our charge, is very minimal to do a thaw transfer in the future. The only other cost that you'll have, though, is the cost of the gestational carrier again and doing that part.
So I think we've said enough about ourselves. What we really want to do is answer your questions. We want to see what specific questions that you had in order to be able to just really address your good questions and concerns. And please, what we're going to do is going to alternate questions, and so please feel free to ask anything you want.
You discussed about doing instead of, let's say, twins, 1 baby and second one. What we're interested in is in freezing the embryos because we want to have the same mother, the same genetic mother for the babies. Do you have this ability?
Yes. Go ahead. Okay. So we actually, over the last 10 years, have been one of the leaders in frozen embryo transfers in the United States. If you look at it, all the papers that we published, most of them have been on frozen embryo transfers. Our pregnancy rates between fresh embryo transfer and frozen embryo transfer is very, very close. I think it's close to 80% for fresh embryo, and it's about 70% for frozen embryo transfer. So we feel very confident about frozen embryo transfers. In fact, we have a couple right now from friends, and they found a donor that they love, but the donor is only available until April. After April, she's not available, but the surrogate is not going to be available until after May. So what we're going to do is we're going to just, and we do this many times with our couples, is we're going to retrieve the eggs of the donor, we're going to fertilize the eggs, and we're going to have embryos. So now the embryos are frozen, and then when the surrogate is ready, we just thaw the embryo to put it back in. And really the pregnancy rate with that is no different than if we did a fresh embryo transfer. And in our clinic, we don't ever charge for frozen embryo transfers. If for some reason the first transfer doesn't work, let's say we do a fresh embryo transfer or frozen and it doesn't work, and you have other frozen embryos, and we have to do the whole process again, as far as our clinic is concerned, the agency may have different charges, but as far as we're concerned, there are no further charges. And there are some agencies, and you can talk to them specifically about that, that have the same program. They say, okay, if it doesn't work the first time and you're using the same surrogate and everything, then they're not going to charge you either. So those are the kind of agencies we want to work with, because we don't want our prospective parents to have another charge if the first cycle doesn't work.
But this takes some of the burden away from having to put in two. Because if you know that if you put in one, if it doesn't work, you can just go right into putting another one in 4 weeks later, then there isn't that pressure to want to put in as many as you can to get it done, to get it to work. And we really want to get that pressure off because, again, it's really safer to do one. Yes?
It's 4 weeks later with the same surrogate?
Yes.
Yes, because all we need to do is, if we find out, once we put the embryo back in, we find out 5 days later if it worked or not, the first sign, 10 days for the confirmatory test. So we know 10 days after we put it in whether it worked or not. If it didn't work, we take the surrogate off medications. 4 days later, she has her period, and then we can start again. And it'll take 2 weeks to get her uterus ready, so we put it back in. It'll be about 1 month between the last time. Now, sometimes our cycles vary. Sometimes we do a cycle a month for the most part, but sometimes we'll start one on the 1st of a month, the next time maybe on the 6th of the month, so sometimes instead of 4 weeks, it might be 5 weeks or 6 weeks, but pretty close.
And what happens in the case of miscarriage?
Same thing. If a woman gets pregnant, she has a miscarriage, that counts like a no pregnancy. So there's no charge. We just have her get back to zero. That doesn't take 4 weeks. Sometimes we have to wait for 6 weeks or 7 weeks for all her hormone levels to get down after the miscarriage. And we monitor those. As soon as they're down to normal, then we start her again, and then we can do the transfer again. And again, from our clinic, no charge. That is, the charge is really to get the embryos. That's really what it is. It's not putting them back.
Could we talk about the prices of?
Well, what I'd rather do is, we're going to have you. What we do is we will have you talk with. We'll give you general prices here. Dr. D will give that in just a minute. But what we do is we have you actually talk very specifics with the head of our finance department. They go over it very, very clearly, concisely, and they have it broken down into what the different prices are. And the agencies have their own prices, but we can give you some estimates. We'll give you just kind of a ballpark estimate for the whole thing now, but you'll get a very specific one there. Go ahead, say it.
Well, if you look at prices, most clinics you talk to are going to have prices anywhere between $25,000 to $35,000. That's the range, in terms of, because some of them have packages, and they say, okay, if it doesn't work the first time, we'll do it again, no cost. Some of them have like donor guarantees. If you choose this one particular donor and it doesn't work, then we choose another one for you at no cost. At our clinic, we're very confident about our pregnancy rates, and we tell you one thing: if all the services that we offer, if you find it at another clinic at a lesser cost, we will match that cost. So if you have someone here that says, oh, I'll do this, all of this, what they're doing, but I'll charge you this much less, then that's fine. You just bring us, you email us and say, this is what I've gotten from a clinic in Massachusetts, then we'll match it. And we've had that policy in our clinic for well over 10 years for all of our patients. So we tell our patients, this is our cost. These are all the services that are included in our cost. If you have some place that you've gone to that offers you for less cost, please give us just the information and we will match it. So that's what we tell you. We don't have any discounts today to offer, or saying we just don't, because we just say if you find the same services somewhere else and it's less costly for you, we'll just match it. And as I said, if you look at the journey, it's you're talking about somewhere around, depending on packages, somewhere between $25,000 to $37,000 is the cost for the clinic. And typically the $35,000, $37,000, those are the packages where if you do a fresh embryo transfer, that doesn't work, and then you use up all your frozen embryos, and that still doesn't work, then the whole process starts again, there's no cost. Typically those packages are more closer to like $35,000, $37,000. For one cycle packages, they're closer to $25,000, $30,000 depending on. But those are the ranges that you're going to find. But I would tell you that the most expensive part of surrogacy is when it doesn't work. So in order for you to look at just cost, that's just one aspect of it. The other thing that you should definitely look at is pregnancy rates. You should look at every clinic's pregnancy rates with their fresh transfer and with their frozen transfer. Not just to look at the fresh, look at the frozen too, because if for some reason that doesn't work, you want to make sure you have a clinic that has very high frozen embryo transfer rates.
And our rates are virtually identical for fresh and frozen with using a surrogate. There's really not much of a difference, like a 4% difference. So and that's not even statistically significant. So it's from your perspective, it should be very comforting to know that if it doesn't work when we do it the first time, there's no charge from us, and the chances that it's going to work the next time are the same.